Hello and welcome to the In-Network podcast feature Designing for Health. I'm Nordic's Chief Medical Officer, Dr. Craig Joseph. In this episode, we tackle one of healthcare's least glamorous but most consequential problems, identity. Not the philosophical kind, but the very real, very messy challenge of knowing exactly who you're dealing with. Patients, clinicians, staff, and everyone in between. I'm joined by Edmund Siy, CIO of Secours Mercy Health, and Alex Krinsky from Clear, to explore why identity management has quietly become foundational to both security and experience. We dig into why healthcare made this harder than it needed to be, what happens when you get it wrong, and how newer approaches like biometric identity aim to reduce friction without sacrificing security. If you're a health system or physician leader, this isn't just an IT issue. It's a workflow, safety, and burnout issue hiding in plain sight. Let's plug in. So welcome to the podcast, Edmund Siy and Alex Krinsky. I'm excited about this conversation that we're going to have today because it's a little different than the normal episodes that we do. But before we get into the conversation, Edmund, why don't we start with you? Where did we hear from you today? And give us maybe a little bit of background about who you are, what you do, how you got here, this current crazy job of yours.
Sure. Thank you, Craig, for having me. So I serve as the Chief Information and Technology Officer at Secours Mercy Health. I've had this role for a year. I've spent the last dozen or so years in healthcare, and then the first 15 years of my career were in media and entertainment. So we can talk movies as well, if you like.
Oh, we're going to talk about that.
Absolutely. All right. And I am in Bridgewater, New Jersey. So Somerset County, kind of central Jersey.
Okay. And can you give us your actual address and also your...
Clear will protect me.
Let's hear about something from Clear. Alex, you apparently work for some company named Clear. Edmund gave it away.
I do. You find me in Orange County, although I'm typically based in New York City. I'm a proud New Yorker, and Clear is headquartered there. My background has been entirely in healthcare. I started with my tour of duty at Epic in implementation services there, focused on their outpatient clinical products, and really loved my time there and loved working with providers through Epic. Then went into the digital health space and worked at a few startups based in New York City. I've been with Clear 3 years now, entirely focused on how we bring Clear's identity product from the airport into the healthcare market, and have been fortunate to work with some incredible partners like Nordic and like Secours that help us operationalize this with patients and with providers. And so happy to delve further into that.
And we will. All right, Edmund, you teased us a little bit about coming from the music and kind of movie industry. So how did your work there, how does it compare to kind of being now in healthcare at Secours Mercy Health? Is there any difference between being a kind of a technical leader in the TV industry and healthcare? Are they exactly the same? Is it just like the pit, Edmund? Is it just like the pit?
That's a great, So I think from one perspective, the technology is the same. We were an SAP shop, right? We're an Epic shop, and I think it's these big sort of platform plays. So that was definitely very similar. I think on the surface, you assume the business is different, but it's actually very similar. So when I was there, we were the number one provider of primetime television shows, right? You looked at things in this episodic fashion. Can I get this show on CBS, on NBC, on ABC, right? And so that it sounds and feels like kind of fee-based care, right? The way we're in today. Fast forward to today, we're all splurging on Netflix or HBO Max watching The Pit, a Warner Brothers show, by the way. And if I think of the Netflix model, it's value-based care. So there actually are there are more parallels than you think. And so if I get stuck, I think of SAP, and I think of being in that big room with all these creative execs who are a lot like our wonderful physicians, right? Just trying to do this wonderful thing instead of creating content, taking care of patients.
Okay, I like that. So let's set the stage and talk about what Alex kind of referenced a few minutes ago, identity management. And so from your perspective as the CIO at a big healthcare system with lots of hospitals and clinics, how does identity management how does it work at a typical organization in healthcare? Like, I guess what I'm trying to do is say, like, before we kind of delve down into what Clear does, how did it work in the past? I just put in my username and password and you assumed it was me. Is that right?
I wish it was that easy. I think there's probably a couple things at play. Healthcare is growing at this tremendous pace that it probably is ahead of, when we were growing, there was no such thing as this enterprise kind of identity management, right? And so I think that's part of it. Craig, just hanging out with you and hanging out with the other physicians, I think I failed to realize how complex our business is, right? Coming from media and entertainment, everyone's an employee. Well, we have employed physicians, we have independent physicians. We have these third parties that we work with, right? That help us on imaging dualities, or what about students or residents or volunteers? I mean, this gets there's all these cohorts, and then I think this play of sort of everyone's been trying to grow, right? The mergers and acquisitions. So then you're inheriting from this organization, from that organization. And so I think you just get this very complex, wieldy kind of scenario that you've got to try to figure out. How can you make this easier for our patients, for our providers, for our associates? I think that's the hand we're dealt today.
Yeah. So I guess it's more complicated than when I started practicing medicine, which was 157 years ago, where, I think I had to get a password into one app, basically to look up lab results. That was it. And now there's so many things that we are automating that you're responsible for from the healthcare system. And it's not just the electronic health record. You have employees, as you've mentioned, and they have software that they need to interact with. And and so I do get it.
And throw in the fact that we are helping people at their most vulnerable. I mean, that's the one that hits me. So then here we are trying to take care of them. And yet, and then the provider needs to, MFA is triggered or whatever, right? We have to make this easy, period, or easier.
Yes. I mean, you could just get rid of all of the computers and then we can that would help. But it might not. I guess that should be a question for Alex. Alex, are you recommending we get rid of all the computers?
I want to go back to all faxing and all filing cabinets.
Okay. Before you were born. I love it.
No, absolutely not. But I think you both bring up really interesting points as Clear was evaluating, its entrance into healthcare and going beyond the airport. Edmund, to your point, a health system, a provider, a health plan, you manage the identity. Sometimes you may not think about it as identity, but you are interacting with so many different types of personas, whether that's your employees, patients, visitors, vendors. And Craig, you brought up the great point that you as a practicing physician, you want to be fully focused on providing care. You don't want to spend time remembering passwords, getting locked out, forgetting your badge and not being able to access your computer. It's a macro enterprise challenge, but it also comes back to what's the experience of that patient or provider. And what identity looked like in healthcare previously was really fragmented. I think that's a big part of it. I think each of those individuals that Edmund named, they were verifying themselves through different means. Maybe they were getting asked the credit bureau questions about what street they lived on 20 years ago. Maybe they were receiving a phone call and asking to give their data and their social. Maybe they were signing a clipboard and not being verified at all. And so I think as we move into the next phase of, healthcare IT, we're going to find identity being foundational, really to enable providers like you both to provide good care and for patients to, have a simple experience when they want to receive care.
So let's actually talk about that experience. I think a lot of people know about Clear at the airport, and because they either they're Clear members and they use Clear when they go to the airport, or they've at least seen it and are upset when people who got their later than them, get through security earlier than they are. I've been on both sides of this equation, so
Well, where are
feel
you
like
now? Edmund, are you a Clear member?
I am not a Clear member.
Okay. Whoa. We're going to have to,
we're gonna have to
offline.
All right. but to your point though, Alex, I'm TSA. I do the visual check or the TSA, and it is a completely different experience, right? Even when we had all those lines a couple of weeks ago, that was so. I can only imagine your world being even faster and more consistent.
And we work, really closely in partnership with the TSA and the airports, and we are thrilled to see the technology evolving across the board. Clear wants travelers across the United States to have a simpler time getting through the checkpoint. And so, to your point, the new TSA offerings are really great for consumers as well.
Yeah. Though Alex, when I filed my return, they did ask. They did. My CPA does use Clear, so I did have to authenticate. So.
Well, glad to have you on board.
Yes, you're in, Edmund. And so, Alex, let's kind of talk about that. You had mentioned how when Clear was kind of looking into healthcare, and obviously you've made that move, and you've got a healthcare background from that working in technology, working for Epic, a big electronic health record vendor. So how does Clear kind of work in the healthcare space? If I'm a patient, how will I be interacting potentially with Clear? And I guess what I'm looking for is without and with, like, what's the experience like? How do I identify? How do I make sure that my patient is who they say they are without some of this technology, and then with some of the newer technology?
Yeah, it's actually a really interesting story. When Clear's co-founders bought Clear out of bankruptcy in 2010, in the initial investor letter, it was starting with airports, but they saw a really big opportunity for biometric identity verification, across your day-to-day, whether you're interacting with financial services or your healthcare provider. And so we started in the airports, but it's always been about going beyond airports. And what we found in healthcare, especially, is that it's really similar to, a highly regulated zero-fail airport environment, in that you want to balance best-in-class security with a good, simple consumer experience. You want consumers to trust you. You want consumers to be happy. And so as we've expanded into healthcare, it's been with a product called Clear One, which is a secure identity platform. And what it does is it allows a patient or a provider to verify their identity from a mobile device with a selfie. It can be that simple. And we have 38 million verified identities on our network. And so once you're verified, so Edmund, since you verified, when you present at Secours, Mercy Health, to create a MyChart account, it can be as simple as using a selfie to do so. And so to your point, Craig, what are we replacing? For patients, we're replacing the clipboard. We're replacing all of those screens where you have to type in your demographic data, fill out the CAPTCHA where it asks you which square the bicycle is in, and you can't ever tell if it's actually a bicycle. The knowledge-based authentication questions based on your credit history, which is very insecure at this point, unfortunately. And so all of that gets eliminated. And with Clear, you enter some information, you take a selfie, and then you can reuse it. And it's the same for providers as well.
And so on the provider side, whether I'm a doctor or a nurse, when would I be doing this? Because already I've got an ID tag, and when would I be kind of interacting with identity management, whether it's Clear or anything else?
Yeah. So, it kind of starts with onboarding. So the Joint Commission actually has kind of processes around how you onboard practitioners, how you verify their identity when they join your organization. I think the use case that's really become critical over the past several years is account recovery or password resets. This is where organizations are extremely vulnerable. This is the simple social engineering scam where someone calls Bon Secours Mercy Health, says, I'm Dr. Krinsky, has some PII or some data about them, and is able to reset a password and get into the system. It's really simple, but unfortunately very effective. And so where a lot of our customers start is enabling Clear in those workflows so that when Dr. Krinsky is requesting access to patient data, they can really know that individual at the device was Dr. Krinsky in that moment. So that's been a big differentiator for our healthcare partners.
And so, Edmund, I know Secours is just starting down this path with Clear. Were some of these the problems that you were trying to solve? Why?
Absolutely.
Yeah. Why are you going down this path, I guess?
We are in the care ministry, right? That's our lot in life. And Alex actually said something that I can completely align to. But trust is everything, right? These, as I mentioned earlier, these patients are entrusting us at their most vulnerable. And really, they're only asking us for a couple of things, right? To know them, to guide them, and ultimately care for them. That's what they're asking for. And so to do that right, to do that in a compassionate way, trust has to be there. And I think you can take that in every process that Alex just defined. That's what really drove this. Yes, like most help desks, we're getting those calls that Alex described. But I think it's more than that. This is not just a capability. This is a new way of thinking. That's how we've embraced it.
Okay. So, and I think I might know the answer, but what happens if you get it wrong?
Yeah. No. I mean, I think, three of us could spend probably hours on regulatory, financial, right, reputation. I think I'll button it down to that patient. Right. I mean, again, I'll go back to what Alex said, trust. They are entrusting us. If we get it wrong, we're breaking that trust. That is, in my mind, unacceptable. We can't do that.
Okay. All right. I will accept that answer, Edmund. So kind of getting down to how you design these systems. Oftentimes it's, do you want security or do you want, lack of friction? In the past, it's kind of been like, you can't have both of those. If you want it to be easy, then it's a little less secure. And if you want high security, then people have to give you their fingerprints and, take a DNA swab before they can prescribe controlled substances, it seems. How do you, and I guess this question will start with Alex, how do you find that sweet spot between making it as friction-free as possible, yet maintaining the security so that you can maintain the trust of the patients?
Yeah, I mean, this is what Clear obsesses over day to day. And I think what we are, working with partners to bring into the market is a simple consumer experience, something that you would expect in any retail environment or any, people always, talk about the Amazon shopping experience. Simple, easy, you trust it, but best in class security. So from a security perspective, Clear is certified at NIST IL2. And essentially what that means is in real time, we are verifying multiple pieces of evidence. And just to give an example of how we've evolved here, historically, that evidence could be, uploading documents, uploading bills, uploading statements, things that, take time, minutes, hours. What we have built is, a real-time product where, for a new user to go through a first-time flow, it can take a minute. And in that minute, we are combining a biometric, a selfie, with their government ID. And then the special sauce is we compare that data from the government ID to other authoritative databases. And when you string all of that together and layer in different fraud signals, it becomes very challenging and very costly for bad actors to defeat. And so to say it more concisely, it's that IL2 level of security, but it's simple for the end user. And they don't have to be prompted or be a part of all of the hard work and corroboration that's going on in the background. And I think, Edmund, you brought up a really good point that I wanted to also highlight is this doesn't work if people don't use it. And that also comes back to trust. And so with Clear, whether it's for a provider or for a patient, it's opt-in. You consent every single time you use Clear. And I think as we've moved from the airport to healthcare, that's been absolutely critical, making sure that a patient understands what they're going through, why, and can consent to share information with their provider.
Yeah, that finding that kind of that sweet spot and making sure that the folks that are using the service understand what their alternatives are, right? You don't have to use Clear in this instance. There are going to be other ways, but oftentimes they can be a little more onerous, right? Because you were able to take away some of the friction by having access to these incredible databases that, like you said, it makes it very difficult and costly for bad actors to fake it. If it's even possible, they're going to have to do a lot of work. So traditionally,
what's powerful? Oh,
please.
Sorry. I was going to say, what's powerful is that trust, right? That begets the partnership, right? And so so that IT can partner with providers to make this, I love what you said, easy yet secure. And I think you can have it. You can have both, Craig. I think whether it's a Hollywood script that I'm going to write or the reality of hospitals and clinics today, you can have it both. In fact, we should strive for both. It's like that airplane. We can do it.
Yeah. Well, yes, for sure. It's funny that you mentioned, with the airplane, we've been focused, I think, in healthcare a lot on, up until recently, it's been almost just like a laser focused on the patient experience. But now we're also need to focus and acknowledge that it's not just the patients, it's the people who take care of them, from the doctors and nurses to the folks that check them in to the, every one of those thousands and thousands of employees for a big healthcare system. And reminds me of just because I tend to be, I think like Alex, we're on planes a lot. And every time I get on a plane, you hear the same thing. Put your own if the oxygen mask falls, which hopefully it won't, but if it does, make sure to put yours on before you put that on of someone else, because you're not going to be able to help them. And I think that's true. We've seen so much burnout with clinicians, and sometimes that burnout is from exogenous events that we can't control. For instance, I don't know, a pandemic. We can't do much about that. But if we're making it difficult to write a prescription or to get information, all these little tiny 1 to 2 second delays really do add up. And so I'm assuming it's incumbent upon CIOs and others who are in the healthcare space to look not only at the patient, but also how their employees are dealing with some of these stressors.
Yeah. You brought up the pit earlier. I think the power of the pit, in fact, before the last season finale, they had special screenings for providers. And I think that's why the show has been so successful, because providers see this and caregivers go, God, that's me. That's what's happening to me. And so it resonates, right? And so I agree with you that's a challenge for us, for our industry.
I have a confession to make. I haven't seen the pit, but it sounds like I have some homework to do.
I don't even know if we can carry on.
Yeah, both of your jaws just dropped.
So I'll say this, Alex. Like when I first started, when I watched it, when it first came out, I watched it, and I couldn't but I got frustrated on behalf of the characters, I think, that I couldn't watch it. Like it made me anxious and irritated. And so it did have to sit with me for many months before I went back and started watching it again. And it was like, oh, it's a TV show. Okay. Okay. But
it stirs that emotion when, again, I don't want to give away any plot lines, but there's a cyber event. I was jumping up and down at home telling my family that's what we do, right? I mean, to actually see it on TV. So
I need to watch this.
You need to watch it.
Everyone that enters, goes into the healthcare industry. It sounds like I feel like when I started at Epic, my dad is a practicing physician, so I came from a baseline of hearing about it in the day to day, being empathetic to how he interacted with his EHR or wanted to not interact with his EHR. I felt like that really informed kind of my day to day. It sounds like this is a good new calibration to understand what's going on in the day to day of providers.
Yes. Craig and I are going to take you to the Warner Brothers lot so you can see it. That's what we're going to do.
Oh, yeah. Yes, I will take you there, Alex, having never been there. But let's go. Like, this is Edmund, we've got this on tape, obviously, and video. So now you have to do it. All right. Well, yes, the pit is a interesting. I think they put what happens in an emergency department in 1 or 2 years, and it gets scrunched down to 6 hours, and so it's not realistic from that standpoint. But I think each individual piece is accurate. All All right, Edmund, question for you. A lot of IT, a lot of healthcare IT actually has a reputation of kind of buying some technology and bolting it on, and makes it for like, well, first you have to go here and then you have to go there. How do you think about kind of designing systems? And in this case, we're talking about identity verification, but it doesn't really matter. We could talk about lots of other things where it's part of the workflow. It's not a detour from the workflow.
Sure. You are right. We are enamored by that shiny object, by that deal of the century that expires at the end of the month or the end of the year, right? And I think you have to go back to why we're in this wonderful uh, uh, care ministry. And so I would go down to it's the process, right? Really working closely with all the caregivers to really understand the process, to understand the pain points, and ultimately to make their lives easier. I think you have to start with that baseline. And as you do that, the capabilities, the tech, whatever it is that you're putting in, because not all the solutions may be sort of tech enabled. I mean, probably in this day and age, that's probably less likely, but it's really just making their lives simpler. So I think it's that focus on process and people. You double down on that and really try to find the meaning and the purpose and really maybe ultimately the root cause, right? We got to solve the problem.
Yeah, no, I love that. I'm sorry. Go ahead, Alex.
No, I was good. Edmund, I was just curious, being on the other side of the equation, I see so many digital health offerings and so many organizations that are bringing solutions to provider groups. In your seat, how do you evaluate, an IT, like someone selling? What are you looking for when you go to your team? What are the proof points or the questions you ask?
Integration. That's the way I would answer. I think, yes, it has to be secure, right? Yes, it has to work in that given, whatever it's trying to solve. But we're looking for this end-to-end kind of way to support our caregivers to give the best care that they can. And so if it's disjointed, if it's difficult, that's the biggest friction point, right? We have to help Craig and his colleagues to be able to give the best care. That to me, that's paramount. And if we do that, the rest of it kind of just falls in place.
Alex, I'm gonna. First of all, I'm a little irritated that you're asking questions when that's.
I was going to ask if I'm allowed to ask questions. I wasn't sure.
And had you asked that question, the answer would have been no. But since you didn't, and you did, I'm going to throw a similar question right back at you. Is that you're in your jobs in past and current, you've worked across and seen many EHR vendors and big healthcare systems and smaller healthcare systems, and some that are more technically mature than others. I'll throw that question back to you. What separates kind of implementations that work, that stick, versus ones that stall or are completed, but when you go back a year from now, people are like, nah, we don't really do that anymore. What's the secret sauce? We heard you certainly need to be an integrated system and understand where data is flowing. But is there an easy answer? I suspect there's not, but I'd love for you to tell us what it is if it exists.
Yeah, I think from my time at Epic and I was at Flatiron Health where I led implementation for an oncology specific EHR. And I think the first thing I would say is turning on any new technology within a provider environment is really challenging. Not just the technical lift, but change management is so important. And, Edmund, to your point, whether it's something new for a provider or for a patient, it's so critical that they understand it, they trust it, and they use it, right? They adopt it. I think at Clear, two things have stood out that, I think we've done well. One is just to echo Edmund, we listened to our health system partners. It was, there were some obvious patterns of the systems they use, right? So Epic, Microsoft, Okta, Ping, Workday. And so we've invested a lot in limiting the technical lift for those systems and building integrations that are relatively simple to turn on. I think the other part, and that has been exciting to watch at Clear, is really empowering customers to just understand the steps they need to take. I feel like in previous lives I've lived in implementation, it was a lot of meetings, a lot of hand holding. And I think at Clear, we're able to really effectively lay out how the software works and what decisions need to be made. And then little things like what language is helpful. How do you explain selfie-based identity verification to, a 67-year-old patient, which is different than a 33-year-old patient? And so we help with that as well and provide examples that they can use. And, all of that comes together with, resourcing on the partner side to make sure it's rolled out effectively.
Yeah, I love that. It reminds me of a story I read about Yonder, the Yonder bag or pouch that schools and some theaters have used, concert halls, where they, kind of make you put your phone away so that you can focus on the experience. And in schools, they found, to your point, that it's not the technology. In this case, it's a bag, but that's not what's the difference maker. It's how is it implemented? What kind of change management? Were the parents, in the case of students, were the parents involved as well as the students? And it's that kind of big picture. All right, we're close to running out of time. Edmund, I wanted to throw a question to you about what would someone in your shoes, a health system leader, maybe a technology leader, maybe an operations leader, who wants to modernize their identity verification, where do you recommend they start? Or what should they be thinking about?
Oh, I love this question. I would tell them to go round with the nurses, round on a Friday night in the ER, which I've gotten to do a couple times, round at the clinics, round with the specialists. I think it'll give you this wide spectrum of not only, I don't want to call it challenges, the opportunities to really make a difference. I think the fact that you premise the question with a health system leader, there is, I am biased. There's no nobler profession than healthcare. And the fact that we get to use this awesome tech to make a difference. I think, again, I would start with rounding. I would end with rounding. Rounding it's profound experience. So I think, Craig, you need to take Alex and I rounding. That'll be your takeaway.
All right. That's easy. I got the easy job, I think. All right. Well, I think that is good advice, kind of making sure that you understand where the end users, in this case, the doctors and the nurses and the technologists, are, seeing their understanding the life that they're leading day to day does as a good first step for everything. All right. Well, we have run out of time. I have one last question. I always ask the same question. So, Alex, let me ask this question of you first. What is something that's so well designed that it brings you joy or happiness whenever you interact with it? And don't say the Clear app. Like, that's not.
But I can say that.
You certainly can.
You're allowed to say that. I was going to talk about, spoiler, Craig told us he was going to ask this question. I was going to talk about my water pitcher, but I heard that was too boring. So I'm going to talk about my favorite watch. I've gotten very into watches. Also, Craig, I know that on the Nordic team, you have a lot of neurological interest there. There's a lot of people on the Nordic side that love beautiful watches.
That is accurate.
Yes.
That is accurate.
Wow.
But for my wedding, my wife, as a gift, got me a Grand Seiko with a spring drive. And the spring drive, I'm a half expert on this, but in the world of mechanical watches, the reason people love these watches is because they have these movements that are handmade and accurate. Apple watches are more accurate, but they love mechanical watches. Grand Seiko has a technology called a spring drive, which is still a mainspring, so a mechanical movement, but it has some quartz elements. And basically the result is the second hand moves smoothly around the dial. It doesn't tick. And it's so beautiful. And every time I put on the watch, I look at it and I love looking at it. So maybe it's because I got married in it that I love it, but maybe it's because of the spring drive. So I wanted to give a shout out to Grand Seiko.
That's a good answer. And if your wife happens to be listening, you're gonna get extra credit for that. But boy, that Edmund now, he's raised the bar for you.
He is, he's gonna beat me because it's funny. I started thinking about tech. I'm a big Apple Watch guy. I've got an EV. I love those two. And I'm very planful. That's my other favorite word. Very planful. So my answer is going to be a little different in that, my family's really tight, super tight. We do a lot of things together. We enjoy doing things together. And you asked, the joy part is what pushed me to respond with my family, because no matter how planful I am, or no matter wherever we decide some cool location, it's actually irrelevant. It's the joy that those plans fall apart. This thing is closed. It's raining. We still have a wonderful time. So I think my answer is going to be this construct of this thing we call family and community. That's what brings me joy.
Edmund, that was such a better answer than me.
Yeah, I feel like Alex needs to reconsider now.
I need to reevaluate all of my priorities.
You guys are much too kind to me because I'm a little taller than both of you.
That's on behalf of Alex, I have to say that's not that impressive. That's not being taller than us is
low.
Yeah, very low.
Yeah.
All right. Well, Alex Krinsky and Edmund Siy, thank you so much. This was a great conversation, and we ended on a high note, so we should just leave it there. Thank you, guys. Really appreciate it.
Thank you, Craig. Thank you, Edmund.
Thank you.
Great to be here.
Thanks for tuning in. We hope you enjoyed today's episode. For more on Edmund and Alex, follow them on LinkedIn. Check back for more episodes of Designing for Health wherever you listen to podcasts or on NordicGlobal.com. We'll see you again next time on Designing for Health. If you enjoyed this episode, please leave us a 5-star rating and a review. This helps others find the podcast as well.